A transient ischemic attack is a stroke that lasts only a few minutes. It happens when the blood supply to part of the brain is briefly blocked. Symptoms of a TIA are like other stroke symptoms, but do not last as long. They happen suddenly, and include numbness or weakness, especially on one side of the body. The TIA is the same as a stroke, except that symptoms only last for a short amount of time. In a TIA, the blood vessel in the brain gets blocked, but the blockage clears by itself. TIA is also known as a mini-stroke, and some people think of it as a funny term. But a TIA is a major warning sign of a stroke. Spotting the signs of a stroke. Spotting the signs of a stroke. The FAST test left helps to spot the 3 most common signs of stroke or TIA. But there are others that you should always take seriously. These include sudden weakness or numbness on one side of the body, including legs, hands or feet, difficulty finding words or speaking in clear sentences, sudden blurred vision or loss of sight or in one or both eyes, sudden memory loss or confusion, and dizziness or a sudden fall, a sudden, severe headache. Stroke can happen to anyone, at any age. Every second counts. If you spot any of these signs of a stroke, don't wait. Call medical emergency services straight away. There is no way of knowing whether you are having a TIA or a full stroke when the symptoms first start. If you, or someone else, show any of the signs of stroke or TIA, you must call if you think you have had a TIA sometime in the past and have not yet sought medical attention. See your GP urgently. Some of these symptoms can be caused by other things such as low blood sugar, a migraine, an inner ear problem or a seizure. However, you cannot be sure of the cause until your symptoms are investigated by a doctor. What causes a TIA? Like a stroke, the TIA is caused by a blockage cutting off the blood supply to part of your brain. The only difference when you have a TIA is that the blockage is temporary. It either dissolves on its own or moves, so that the blood supply returns to normal and your symptoms disappear. The blockage is usually a blood clot, although rarely it can be caused by other things, such as a piece of fatty debris or an air bubble in your bloodstream. Blood clots may form in areas where your arteries have become narrow or furred up by fatty deposits. This process is called atherosclerosis. If you have a heart condition, such as atrial fibrillation, blood clots can form in the heart and move up into your brain. Some strokes and TIAs are caused by small vessel disease, which involves damage to the tiny blood vessels within the brain. Deposits collect in the blood vessels, causing them to thicken. If they become completely blocked, this can lead to a stroke or TIA. Symptoms of a TIA can sometimes be caused by bleeding in your brain called a hemorrhage, but this is unusual. How is a TIA diagnosed and treated? Initial assessment. The TIA is diagnosed with a medical examination, and in many cases a brain scan. Reasons why you might be offered the brain scan include: it is suspected that the TIA is caused by a hemorrhage. The doctor needs to determine the position of the TIA in the brain. The symptoms have been prolonged and therefore a stroke rather than TIA is suspected. Another cause for your symptoms other than TIA is suspected. You are taking anticoagulants. If you have a suspected TIA, you should either be referred straight away to a TIA clinic or seen by a stroke specialist. In most cases you should see a stroke specialist within 24 hours. Everyone who has a TIA is at an increased risk of stroke, so it's important to ask your doctor to explain your own risk, and what you should do to reduce it. As many as 4 out of 5 strokes can be prevented after TIA if the correct tests and treatments are carried out. Treatments to reduce your risk. It is likely that the doctor will give you aspirin to take until you see a stroke specialist. This will help to prevent blood clots forming. Treatments to reduce. Assessment with a specialist. Usually you will be referred to a consultant neurologist, a doctor who specializes in conditions that affect the brain and spine, or a consultant stroke specialist for further assessment. Many hospitals and some GP surgeries have specialist TIA or stroke clinics, so you may be referred to one of these. If the specialist suspects that you have had a TIA, or perhaps that your symptoms are caused by something else, he or she may want you to have a brain scan. You will either have a computed tomography CT scan or a magnetic resonance imaging MRI scan. Both of these produce pictures of your brain and will help doctors to rule out other causes of your symptoms. You may also be offered some of the following tests and checks. Electrocardiogram ECG checks the heartbeat. Doppler ultrasound checks for blockages and narrowing of the neck arteries. Blood pressure measurement. Your blood will be checked for blood clotting, blood sugar, cholesterol levels. You may, if you are diagnosed with a TIA, your specialist should talk to you about the factors that are increasing your risk of stroke and what you can do about them. This may mean taking medication or making changes to your lifestyle, such as stopping smoking, exercising more and drinking less alcohol. For both, what impact will this have on my life? Although the physical symptoms usually disappear quickly, the impact of a TIA can last much longer. With the right treatment, you should start to feel back to normal quickly and you won't have any lasting effects. If you do notice ongoing problems, such as muscle weakness or effects on your memory, understanding, or speech, you need to go to your GP. Although your TIA shouldn't have a lasting impact on the things you do day to day, by law you will have to stop driving for at least 1 month. Anyone who has had a stroke or TIA has to stop driving immediately, but for many this is just temporary. The rules for drivers of lorries, buses and coaches are stricter, and they are required to tell the relevant authorities immediately, and must not drive for 1 year. If you have had more than one TIA within a month, you will need to wait for at least 3 months before you can drive again, and you will have to surrender your license temporarily, until you are considered fit to drive by your doctor. For many people it's the emotional impact of a TIA that lasts the longest. Shock and anger at what has happened, fear of another TIA or stroke, and worry about the effect it may have on your job or relationships are all natural emotions that many people experience. It can help to talk to someone who understands. You can also visit online discussion stroke forums. These are online communities for anyone who has been affected by stroke, where you can share your experiences or concerns, ask questions and receive advice and encouragement from people in similar situations. Will I have a stroke if I've had a TIA? The TIA is a sign that there is a problem with the blood supply to part of your brain, so anyone who has had a TIA is at an increased risk of stroke. The risk is greatest in the days after the TIA, and about half of all strokes that follow the TIA will happen in the first 24 hours, so urgent assessment is essential. 1 in 12 people who have had a TIA could have a stroke within a week after a TIA. If your TIA is urgently investigated and the likely causes are treated, your risk of having a stroke can be dramatically reduced. What can I do to reduce my risk of having another TIA or stroke? Understanding what factors caused your TIA will help you know how you can reduce your risk of having a stroke, or of another TIA. When you have a TIA, doctors check you for any health conditions linked to stroke. If you have any of these conditions, you will be treated to lower the risk of another attack. These health conditions include high blood pressure, atrial fibrillation, irregular heartbeat, diabetes, high cholesterol. One of the best ways to reduce your risk is to carry on with any treatment you are given. You should be given advice about other ways of reducing your risk of another TIA or stroke. Some people need to lose weight, exercise more, give up smoking or drink less alcohol. All of these actions can also help to manage other health conditions and will often make you feel better. If you have any questions or concerns about your medication, go back to your doctor or pharmacist and ask. Tell them if you are worried about side effects, as there will often be an alternative that you can take. Never stop taking your medication without talking to your doctor first. Many people consider having a TIA as a wake-up call and a sign that they need to make some lasting changes to their lifestyle. Support is always available from your GP practice or local stop smoking service to stop smoking. If this is relevant to you, please subscribe.